I'm here to present Senate Bill 435, which will take the necessary first step to uncover trends and potential disparities that are often hidden in aggregated health data information for Latinos and Indigenous Mesoamericans. Latinos make up 40% of California's population. However, within the Latino community, there are several ethnic subgroups that have diverse health outcomes. The National Health Interview survey found that Puerto Rican Americans actually have a higher prevalence of asthma in the United States mainland at 16% compared to Mexicans that have a lower percentage prevalence at 5.4%. These distinctions hide in the monolithic term of Latino. So, and we also know that during the height of the pandemic, Indigenous communities could not access timely and reliable information to access vaccines in California and suffered, unfortunately, a higher death rate as a result. So SB 435 will do a few things. We'll address these shortcomings by requiring that the Department of Healthcare Services, Department of Public Health, Department of Social Services, Department of Aging, and Healthcare Access information will collect and release disaggregated data for specified Latino subgroups. It will also ensure that health data collected by the state reflects the diversity of various subgroups within these populations. Testifying in support of this measure today, I have Mar Velez with the Latino Coalition for a Healthy California and Eugenia Melesio from Centro Binacional para el Desarrollo Indígena Oaxaqueño. That's CBDIO that will come up and testify in support of SB 435, and I ask for your aye vote, respectfully.
Thank you. We'll now move on to lead witnesses support. Good morning.
Good morning, Chair and members of the committee. My name is Mar Velez, Director of Policy with the Latino Coalition for a Healthy California. LCHC is a proud co-sponsor of SB 435, authored by Senator Elena Gonzalez, which will collect and disaggregate anonymous demographic data and language data for Latinx subgroups and Indigenous Mesoamericans in California. The goal of SB 435 is to uncover and reduce underlying health disparities, both clinical and those related to the social determinants of health, such as housing, for Latinx and Indigenous nations in California. Research shows that more specific, high-quality demographic data is beneficial to address and effectively meet the health needs of diverse populations. During the pandemic, Latinos were disproportionately impacted by COVID-19. We are 1.7 times more likely to contract COVID and 2.8 times more likely to die from the virus. We now know that people who have underlying medical conditions are the most at risk for serious complications with COVID, and Latinos are more likely to have multiple chronic conditions like asthma and diabetes. More specific data could allow public health departments and health systems to provide culturally competent and responsive information and care to address these disparities. And California must also start collecting specific data for Indigenous Mesoamerican nations in California who speak more than 560 languages and dialects. During the pandemic, Indigenous Mesoamericans were also disproportionately impacted, but California does not currently collect data for this population. Indigenous Mesoamerican nations also face language barriers to access timely and reliable information, such as on COVID. And California must start collecting data on Mesoamerican Indigenous languages to understand the specific needs of these communities, to equitably access and utilize healthcare programs, social services, and other resources. And lastly, as the Senator stated, Latinos are not a monolith. We are diverse in terms of national origin, race, culture, language, and other demographic factors. And Latinidad is not all-encompassing and often erases Indigenous identity. SB 435 highlights and brings awareness to our unique and diverse differences and ensures health equity for Indigenous and Latinos across California. With that, I respectfully ask for your aye vote for SB 435.
Thank you very much. Any other lead witness? I think you had two.
Yes. And we have our translator as well.
Yes, okay.
Thank you.
Good morning, welcome.
Aku cuevanto, shindavin into taso ondoña condato un tisi into bichoma. Yo cuiñe San Miguel Cuevas. Buenos días a todos. Muchas gracias por escuchar lo que queremos conversar con ustedes. Yo soy de la comunidad indígena y no me considero una hispana, ya que tengo muchas barreras cuando se me considera una hispana. Yo, como mucha gente de mi comunidad, hemos batallado mucho para poder recibir los servicios porque no están marcados nuestra etnicidad. Hablamos mixteco y estamos teniendo muchas barreras para poder recibir los beneficios como para nuestra salud y nuestro bienestar. Con mucho respeto, les pido por favor que apoyen la SB 435.
Hello, my name is Judith Martinez. I'm with the Centro Binacional para el Desarrollo Indígena Oaxaqueño. Eugenia did speak her native language. It's Mixteco. Many times she says she's put into this category where she's put as a Latina, but many times Indigenous languages are not taken into consideration. This is especially true when getting assistance from agencies and programs on important topics like health and wellness. And with great respect, we ask you to vote yes on SB 435.
Thank you very much. Now let's hear from any other support witnesses here in the room. Please come forward.
Buenos días, mi nombre es Vanessa Terán, soy directora de política con la organización Proyecto Mixteco Indígena y estoy hoy fuertemente en apoyo de SB 435 como parte de la comunidad indígena y latina. Good morning to all. My name is Vanessa Terán. I'm a policy director with the Mixteco Indígena Community Organizing Project. I'm in strong support and respectfully ask for your aye vote on SB 435. Thank you.
Thank you.
Ande bando, Ginañe Alondra Mendoza, Taquín Promotora Salud, Sática, Canto, Quachinsha, Najibi, Nusabi, Tabanacoba Inina. Sani Kainshana, SB Kohmi, Uni, Good morning to all. My name is Alondra Mendoza. I am an advocate with the Mixteco Indígena Community Organizing Project. I am in strong support of SB 435. Thank you.
Thank you.
Good morning, Chair and members. Jennifer Robles with Health Access California in support.
Thank you.
Ando llevando na niña Juvenal Solano, cuya organizador comunitario siña organización Mixteco Indígena Community Organizing Project, nya cuenda nya condado nya Ventura, tiña Kasai Viti, Kakaina, Chindiendo nya Cuña, SV Comi Oni. Good morning, my name is Juvenal Solano, community organizer with Mixteco Indígena Community Organizing Project from Ventura County, and I'm here in strong support of the SB 435. Thank you.
Thank you. Okay, we'll move in. Is there any lead witnesses in opposition? Is there anybody in the room in opposition to this bill? Please come forward now. Seeing none, let's hear from the teleconference service. Is there, moderator, is there any witnesses waiting to testify via the teleconference service? This will either be in support or opposition.
We do have some queuing up for comment at this time. Just bear with us, sir. Okay, our first comment will be from line 9.
Good morning, Chair and members. Sandra Poole, Western Center for Law and Poverty, in support.
Thank you.
And there are others lining up as well. The next comment is from line number 14. Your line is now open.
Good morning, committee and Chair Dodd. My name is Beth Fittler, and I'm calling in support of SB 435 on behalf of the California Food and Farming Network, the California Farm Worker Advocacy Working Group, and Pesticide Action Network. Thank you.
Thank you.
And our next comment is from line number 10.
Good morning, Mr. Chair and members. Ronald Coleman Baeza here on behalf of the California Pan-Ethnic Health Network and also the Having Our Say Coalition in strong support. Thank you.
And we have no further comments at this point, Mr. Chair.
Thank you very much. Now, having heard from support and actually no opposition witnesses, we'll bring the discussion back to the members. Anybody wishing to address this bill? Seeing none, Senator Gonzalez, would you like to close?
I just want to say thank you for entertaining this bill. There's over 200,000 different Indigenous communities or Indigenous people in California. And there's a large Oaxacan community, of course, in Los Angeles. But outside of that, so many vibrant communities, as you've seen here, just want an opportunity for equity in their health data. So with that, I respectfully ask for an aye vote.